Welcome back in, folks. I'm here with Sean Sibley with the University of Maine. Thank you for taking the time to be here.
Yeah, thanks, Doug. Great to be here.
Now, we're here to talk about Umaine's efforts bolstering the state's nursing workforce, in particular in rural areas. So, first, let me ask you, what do you do for the University of Maine?
Sure. So I'm clinical faculty at the University of Maine, and I have the privilege of leading our family nurse practitioner program.
So, from your perspective, why does Maine's rural, healthcare and nursing workforce, why does that need bolstering?
Yeah, well, I think everybody in our local communities is feeling it. There's a lot of lacking access when it comes to, in particular, primary care, which is one of our focus areas. And also, about 60% of the state's population lives in rural areas. So thinking about access to care, having to travel, it prevents people from really getting the care that they need and deserve. So it's important to us at the university.
And it's interesting that you mentioned 60%. When you think of rural areas, you think of, maybe not as many people, but Maine has such a diverse and large rural population. What is Umaine doing to help with this?
Sure. So the University of Maine, as the state's land-grant university, really has an obligation to the state to provide a workforce to care for all of our communities and our people. Particularly in our nursing program, we've always had a really strong bachelor's program to prepare registered nurses. A lot of people think of nurses as registered nurses, but there's kind of a level up from that. And advanced practice nurses, family nurse practitioners being under that umbrella, are also a big focus in our program. So since 1992, we've been graduating family nurse practitioners to care for people all over the state and elsewhere. Particularly a couple of years ago, we were fortunate to receive a large federal grant through the Health Services and Research Administration, where we could pay the tuition for nurses to overcome the barrier of tuition and maybe stepping away from their registered nurse role a bit and continue their education to be a family nurse practitioner, which family nurse practitioners are really specifically educated to provide primary care, which is that main partner in making sure you get everything you need and manage your chronic diseases and really flourish and have quality of life.
Yeah, how important is it to be able to give these opportunities to people that, some people just want to get right out and work. But how important is it to offer those opportunities?
Yeah, so nurse practitioners, when they go back to school, they've worked as registered nurses and have experience working in the communities clinically. And so usually there's a real desire there, but there are a lot of reasons why it's hard to go back to school and do that. And the cost of tuition is one of those. And so that's why we've really pursued these grant opportunities so that we can just get people into those programs and get them out there working in the communities at that advanced level.
Absolutely. It's so important to, once you get to the workforce, it helps to know what you're doing a little bit, I'm sure.
Yes, yeah. We're very proud of our graduates. We had 7 trainees from our grant program last year graduate, the majority of them working in medically underserved areas, some of them traveling even a couple of hours themselves to provide care to populations on a daily basis in primary care settings. And we just had another 6 graduate, and our enrollment is actually increasing due to the grant, and so we're going to be able to support the workforce even more.
That's fantastic. Well, hopefully this work keeps going, and I'm sure there's a lot of people that need it. So thank you for taking the time to be here.
Yeah, thanks for the opportunity.
All right, we're going to go to break. Thank you.